Hi guys, how you doing? Let's see if this works out now. I'm gonna try to see if I'm gonna get Dr. Marquez in here now, and let's try to share this video now. I think this doesn't have any reverb anymore. Yay. Okay. I think it works now. I think we're good now. Praise the Lord. Okay. Let's try to I think we're all good now. Okay. Good. Yay. We're actually better now. I think we're good. Let me broadcast this better. Okay. Waiting. Add viewer. Invite. Add. Okay. That's so much better. Goodness. That really Ramfis, how are you?
Hello. You again.
Much better. Okay. I think it might be on your end. I think
the feedback?
I think it's on your end.
Oh.
It is.
That's very
It is. It's on your end. The sound. It's on your end.
Oh, so how do I fix that?
Turn it down. Turn it down.
You have both on?
No? Can you hear me better now?
Yeah, it's just me coming back. Bounces back. It's okay.
Can you?
It's okay. No worries. So yesterday, we were having a discussion late last night on domestic violence awareness with our group about well, first of all, I want to know who you are. So you can tell everybody who you are and does everybody know who you are and what you are about.
Okay. My name is Ramfis Marquez. I'm a licensed counselor in the state of Virginia. I'm a clinical psychologist by education. That's my dog, Athena, barking in the background. And she's excited that she's on TV. I am the Director of Behavioral Health Services at Greater Prince William Health Center in Prince William County. I have been the director there now for 5 years. We're quite involved in the community at the center in terms of provision of trainings and provision of services related to trauma. And we work with ACTS and different agencies in the community that help people that are struggling with sexual abuse, domestic violence, and things of that nature. I have a team of 10 clinicians, actually 9 clinicians right now. And most of them are bilingual. They speak either English and Spanish. We have a four-lingual therapist in the team also that speaks French patois, an African dialect, Spanish and English. And we work in integrated care with a series of physicians, dentists, pediatricians, and OBGYN practitioners. And we work collaboratively with all of them at the center. Yeah, that's us.
Okay, awesome. And then, so I know that you work with I know that you help with difficulty, especially with adults and and so I wanted to let people know that a lot of specific issues with domestic violence.
Right.
And so, yesterday we were having a discussion last night about emotional, verbal, and verbal abuse. And so I kind of wanted to touch a little bit base about the effects of the emotional traumatic abuse on the body and how it affects your body. And if you can go a little bit into detail about what is emotional abuse, what is verbal abuse, and what is physical.
Okay. Um, in terms of the manifestations of abuse in the body, there is actually a published book that you can probably purchase in Amazon, and it's a great read. It's called The Body Keeps a Score. And I think it's one of the best published books right now that explains how trauma manifests through the lifetime in the physical aspect of the body. Um, Within that same context, we need to understand the mind body connection and come to the realization that neither of them are separate from each other. And when we are experiencing any type of damage to the emotional well-being and the psychological well-being of a person, it's definitely going to manifest through the neural system and in the endocrinal system in the body. So any form of abuse that a person might experience and any residual damage, what we call trauma, from this abuse will chronically manifest over time in different aspects of the body. So you see people that it can manifest as simple stress or chronic stress, tensions, headaches, nausea, gastric problems, um, pains, a series of body pains that sometimes people do not understand. There's a lot of research now being conducted with multiple musculoskeletal disorders that are chronic in nature and that they're non-receptive to medication. And the common denominator tends to be the notion of trauma in the life of individuals struggling with this type of musculoskeletal disorders. I actually did a lecture about a year and a half ago, maybe 2 years now, for an entity, a nonprofit organization that works with musculoskeletal experts and physicians in the nation, and they're called Movement is Life. And the discussion in that presentation was the relationship of trauma, depressions, anxieties associated with trauma, and conditions of musculoskeletal nature that people try to treat over time with medication, with different muscular therapies, with electrodes and things of that nature. But in reality, what is happening is that the trauma is manifesting physically. Think about trauma as an overload of the sensorial system or your neural process. And this overload is going to manifest in the body because once the brain is unable to process through it anymore, it's just going to trickle down because everything is connected. Sometimes people used to refer to this as a somatic event or a psychosomatic event. And to this day, many providers, many physicians, many clinicians continue to use that terminology as if it was something that was not really happening. The misunderstanding being that anything that is psychosomatic is truly happening in the body. That's the psyche of a human being is actually what guides the whole neural system. And by definition, the neural system is connected to every single organ that we have, every single muscle, everything is connected. So trauma in itself affects all aspects of life. There is the science of this is actually called, I forget all of the time the name. Um, a colleague of mine, Dr. Miller, he's an expert on this subject. It's within the context of applied Applied kinesthesiology. There you go. Applied kinesthesiology. I sorry for that lack of memory all of this. So it's like almost 8, and I've been working all day. So applied kinesthesiology works on the correlationship between the endocrinal, the neurological, the musculoskeletal aspects of the body, and how each one of them impacts the other. They also do a lot of work with the gastric system and how the gastric system is impacted by uh, the different other aspects of the body. And what they have found is that they need to work cohesively, and they need to address all of the needs of the individual as one. Whereas many physicians with specialties, they focus on, okay, so I'm going to give you medications for psychiatric medications, or I'm going to give you pain medication, or I'm going to give you endocrinal improvement medication. The applied kinesthesiologists tend to work with the whole and address all of the needs of the person. I find it to be quite an interesting science. There's a lot of argument around it that is a pseudoscience of some sort because many of their findings cannot be replicated. What I found in the literature makes me believe that the lack of replication is because it's a very individualistic science. So it focuses on the individual, and as individuals, because we're so different, it is extremely hard for many things to be simply replicated, as you would with other aspects of medical science.
Now,
Um,
Victoria, Elizabeth is asking if does that have to do with losing weight too, because trauma has to do with losing weight?
Absolutely. Losing weight tends to be related to different things. Um, One of them can be self-esteem. One of them can be the endocrinal function of the body. Um, Whenever somebody comes to practice at our center, the first thing that we do is make a referral for blood work to check thyroid, to check vitamin D levels, to check vitamin B levels, to check iron levels, to check for anemia, cholesterol, and all of these things, because many of these things impact the emotional well-being in the same way that the emotional well-being impacts all of those aspects of the endocrinal system. So yes, absolutely. People that there's two things that happen. And it's always two different extremes. And when we're doing an assessment, for example, for depression, which often comes associated with trauma, and for anxiety, which often comes associated with trauma, and often, most times, comes associated with domestic violence. What we see are extremes. Either a person that stops eating because they find themselves with absolutely no appetite and they start losing weight dramatically, or individuals that then overeat and eat as a comfort, a form of comfort, to feel better, and then they become obese and morbidly obese, and then their self-esteem starts deteriorating, and then they lose the motivation to be able to engage in the self-care and the coping mechanisms and coping strategies that are needed to try to lose weight. Then there's the endocrinal response of the body to trauma. The body keeps a score where your endocrinal system, even though you might be trying to exercise or you might be trying to eat healthy, it has become compromised because of the traumatic event and the expression of the body to that traumatic event. And then the person finds themselves trying and trying and trying, and nothing is changing. So yeah, it's a very complex process at the centers because we do integrated care. I tend to send people to our dietitian or specialist in diets in the center as they're doing treatment in behavioral health, and then a physician for some form of medication to improve the motivation and enhance the serotonin of the body. But we also need to make sure that the person enhances their endocrinal system and enhances their eating habits so they will have more endorphin in the body, which will improve the motivation. And all of these things combined, I always make a referral for things like yoga or Tai Chi, things that involve mindfulness. So people will slow down, calm down. We do a lot of biofeedback at the center to measure the ability of the person to manage stressors. And this is managed through basically the biofeedback. What does is gives us information of how the person is experiencing their environment and how their world is reacting to the environment in markers of stress. This is done through the dermal response of the body. Yeah, too much.
That's fine. But I also wanted to address another question. I think we addressed that. I think yesterday we were wanting to address, I think Lisa was, and as I think in Lisa's video, we were addressing about narcissism, and we were talking about narcissistic behavior and domestic violence, and narcissistic behavior as it pertains to our abusers. I know that there's many kinds of narcissists, and yesterday we were it was kind of a debated discussion. I know that I posted a couple of links as far as it pertains to the CDC, and also as it pertains to other psychologists, since I think there's like 4 types of narcissists, but I know that maybe if you can go into how many narcissistic behaviors there are as far as it pertains to abusive relationships and narcissist behavior, if you can go into that, because I want them to understand what narcissists are. I know, I'm sorry, Tina. I'm trying not to talk too much.
Actually, this is a perfect segue. Let me actually take a couple of the questions that you put before that I think I jumped. You asked me about psychological, emotional, and verbal abuse as it comes to domestic violence.
Yeah.
People make a lot of differentiations in the labeling of many of these processes. They don't tend to happen in isolation, and they usually come from the aspects of the abusers, either narcissistic or low self-esteem presentation that requires for them to indulge, if you may, in these behaviors of abuse and power and control, where they actually hurt their partners. So conceptually, psychological, emotional, and verbal abuse usually, like I said, come together. Um, Using words that are demeaning, insulting, continuously engaging in commentary that suggests to an individual that they're lesser, that they would be lost without them, that they would never amount to anything without them, and there's a degree of grooming in that process to make the person believe that they cannot leave, that they cannot escape, that they will be completely lost, that they will lose everything if they don't stick with the abuser. Then there's a notion of this back and forth play that tends to happen where the abuser engages in abuse and then he blames the person for the abuse. It is your fault that I became so aggravated and insult you. It is your fault that I hit you. It is your fault that I had to take away your credit card. It is your fault that I need to engage in any of these behaviors that are negative in nature and that are hurting you. It is not my fault. You're making me do it. Along those lines also then is the psychological effect of all of these words and the commentary and how it starts affecting the individual self-perception and self-esteem to the degree that they feel at one point or another that, well, maybe I do deserve this. This is happening to me uh, because this is all like an amount to. Um, so in that sense, all of those patterns of behaviors, they're pathological in nature and they go hand in hand to the point that people fall into this cycle where they feel they cannot escape. Then there's the even larger pattern of then fear, where the person starts saying, well, if you leave me, I will kill you. Or if you leave me, I will kill myself. And then it becomes threatful in nature, and the person starts to exist under this threat. It is important to say that many women that are murdered in the United States in domestic violence situations, this tends to happen where they make a factual threat and start preparing to leave, or when they leave. So if a person that is engaged in a domestic violence situation makes that determination, they should engage with a professional that can help them safety plan and prepare in a way that she will sustain safety through the process and after the process.
Right.
Um, Having said that, there are multiple. There's the malignant, there's the classic, there's the vulnerable narcissist. So there are different manifestations of narcissism. My experience with narcissism is actually quite broad because I used to work in forensics before becoming a clinical psychologist, counselor in the community. So I've seen all of the patterns of narcissism, and what you have with most domestic violence situations are what we called narcissistic behaviors that might not fully meet criteria for a diagnosis, but in nature, the behavior itself is it manifests as narcissistic markers. Um, Many times you have multiple markers of personality disorders, which is what narcissism is. You have some degree of sociopathy. You can find a person with some degree of narcissism. There's people that struggle with some degree of borderline personality disorder within the abusive nature. So the personality disorder markers or the traits tend to go across different spectrums of the personality disorders. Personality disorders in itself are differentiated somewhat from mental health issues because they're aspects of the individual's personality. So medication does not impact it in any way, shape, or form. Uh, some therapies are helpful. Mhm. Some therapies are helpful, but the literature suggests that intensive therapy by an expert in personality disorder is required. Not every therapist can work with personality disorders. Not every therapist knows how to work with personality disorders. The narcissist only cares about self. It has little empathy for others. When you have the vulnerable narcissist, for example, is the individual that is always blaming everybody else, and he does the things that he does, and he then engages in the blame game. As I was mentioning before, because you made me do it, because you put me in this situation, because of what you have done, I had to do this. And this goes from I insult you to I will hit you and abuse you, but it was all because of you. Then there's the notion of the malignant narcissist that also engages in all this verbal communication to humiliate, to force the person to be dependent, to force the person to completely become submissive to them and almost subservient to them. Um, so in that sense, all of them are pathological. There is a nature of the some of the borderline traits where the person is almost like they're always looking for a fight. Um, what if our abuser has all forms? That can happen. That's so. I'll get to that question. A young lady just posted a very interesting question. I saw it here. Um, the borderline aspects where the person that seems to always be looking for a reason to fight and then make the fight bigger than what it is, and it's almost like the simplest thing will explode in World War II, um, and or World War III, and you never know. You find yourself walking in eggshells around this person because you never know what will trigger this person.
Yeah.
And triggering can go from I'm gonna leave the house to I'm gonna kill you. So and this can blow up from I did not took the trash out, and it explodes into an out of control fight, and then it goes from I love you and you're the most important thing in my life and I will never be able to live without you to I hate you, live my life, I don't want you here, you're the worst thing that has happened to me ever in my life. I don't want to see you. And it is almost like an emotional roller coaster all the time with individuals like that. And the emotional humiliation and the emotional manipulation that accompanies the narcissism
Yeah.
and the borderline traits that accompany these behaviors makes it incredibly debilitating for a human being to start functioning, and then people fall in states of depression, people fall in state of anxiety, and in many of the situations, then people start manifesting physical ailments. If somebody asks, what if a person presents all of the narcissistic personality disorders or all of the narcissistic types. What
Right.
you probably are seeing is a person that presents all of the narcissistic traits across all levels of the disorder or all of manifestations of the disorder. And that is actually very common. That's why the categorization in the diagnostic manual that we use for diagnosing people, pardon the redundancy, specifies a caveat now where it's not a person that has a personality disorder, but it's a person that could have multiple traits of a disorder, so multiple aspects of multiple personality disorders, if you may. So that description is quite common. The notion of somebody that might present different aspects of different levels of the personality disorder, and even in some situations, people might present multiple ones and not fully meet criteria for one or the other. If that
Okay.
makes sense.
Yeah.
So if you go to a therapist or a psychiatrist or somebody, you can get away with not getting diagnosed because what you're presenting with is what we call subclinical.
I get it.
Other than the fact that most people that suffer from these things, when they go to a clinician, they lie about their behaviors and they engage in externalization, which is pretty much the
So they
blame
could
game
be
that
they
we
could
call.
be diagnosed with anxiety disorder, and maybe, like she was saying, PTSD, anxiety disorder, depression, and maybe not have that narcissistic behavior.
People can be that. So people behavior is impacted significantly by anxiety, by depression, by PTSD. So moving into the realm of mental health, anxiety can become extremely debilitating, but it can also trigger bouts of anger and aggression in a
Mm-hmm.
response to the overwhelming sensorial process of being anxious. Depression in males tends to manifest most commonly as irritation.
Right.
And that irritation, if it goes unchecked, it can manifest into extreme bouts of anger, impulsivity, explosivity. The same is true for ADHD. There's a lot, adults with ADHD tend to be extremely reactive, emotionally reactive, emotionally impulsive, and then they fall into this pattern of, I am so sorry I did that. I all of a sudden exploded. I don't know what happened. And in many situations that I've seen, they're being honest. So there is a degree of it, it's not malignant in nature, I guess is what I'm trying to say. It's impulsive in nature.
Right.
So there's and these are disorders that affect executive function,
Yeah.
especially adult ADHD affects executive function, which is how we interact with the world, and our response tends to be erratic. The individual's response tends to be erratic when the executive function becomes impaired.
Right.
It's in both the amygdala and other aspects of the brain. People with PTSD tend to be very emotionally reactive,
Right.
and they tend to be on guard all the time,
Yeah.
and they tend to respond to the stimuli in the world in a very startled way
Yeah.
or potentially reactive, explosive, aggressive way, uh, because they're hyper aroused. Their hippocampus, their hypothalamus, their amygdala, everything is activated by the PTSD
Sure.
as a result of the trauma that they have endured themselves. So it is not uncommon for people with PTSD to engage in domestic violence situations and then become extremely remorseful after the fact. The detail with these disorders is that the person needs to be able to admit to themselves that they have a problem. Same thing with people that struggle with severe anger management problems. They need to be able to stop externalizing and say to themselves, I have a problem, I need help, I need an expert to help me. These are things that cannot be treated on their own, they cannot just be dismissed, they're not going to get better on their own. You need to see a therapist, you need to see a psychologist, a counselor, a clinical social worker. Potentially, you will benefit from some form of medication treatment if that's what's recommended. Psychological medication or psychiatric medications or psychopharmacological medications, which is the proper terminology, are non-addictive in their majority. There's certain stimulants that are addictive, and if a person has issues with addiction, they should communicate that to their physician. But things like serotonin reuptakes, like Zoloft, are very good for depression and anxiety, and they have no addictive components, and they help stabilize symptoms and behaviors until the person can process through therapy and develop the coping mechanisms that they need to improve their function. Um, if you engage in therapy, if a person going through this engage in therapy, they should be proactive and they should be open to the process and seek to engage fully inside and outside on all of the recommendations that the therapist is providing to improve their function. What we find in therapy is a lot of people that come 1 week after the other, but they don't follow through on a lot of the recommendations that are given to them on their day to day. So this is really a waste of time for the individual. People that are engaged in this process of domestic violence, if they find themselves that they don't want to separate, that they want to continue in this relationship, they should find a space where they can communicate and try to heal and try to find function. This is very difficult, especially when the violence have become physical. The degree of disrespect, the degree of fear that the victim experiences sometimes is impossible to break and it's impossible to engage in a healthy relationship thereafter. But there have been cases that we've worked on in the past where people have found healing and have found forgiveness for each other and they have continued a healthy life with no abuse. The problem exists where the people think that the violence is going to go away by themselves, be it verbal, physical, psychological, and that is just going to stop and that he's not going to do it again or she's not going to do it again. There are women that engage in domestic violence toward men. And I think that your forum is just for women, but that's the clinical reality. And most of the cases of domestic violence toward men go underreported. So that is also a sad reality.
I would like to know, Lisa wants to know, I would like to know the doctor's opinion on whether or not institutional reform of the judicial system to require outpatient counseling and group for victims of domestic violence and the courts mandating the user to receive a full mental health evaluation prior to being released. Does the doctor feel the judicial system making this a requirement would be beneficial?
Anything that ensures the safety of the community and the safety of victims and the safety of the individual that is engaging in this behavior, I think that is beneficial. I work with the Superior Court of Washington D.C. in a project that I work for the project called Options, and it was a pretrial diversion project where people that had engaged in misdemeanor charges and were struggling with different mental health conditions would be required to undergo treatment. I think that, in all honesty, I think that this was extremely beneficial to people, and people were able to resolve many of the issues that they were struggling and living with, and many of the issues that they have struggled and lived with for many years of their life. To answer the question, yes, I absolutely believe that people should be mandated to engage in treatment. The problem with mandated treatment is that people most of the time do not embrace it and they come in rejecting treatment and feeling, well, they have taken the power away from me. The notion of the mental health court that I work for gave people an option. You can undergo your regular pretrial process and be adjudicated or and go through the whole judicial process, or you can engage in treatment and fully engage in treatment until that provider that is giving you the care determines that you have successfully engaged and completed the process. Um, so I'm not a big fan of mandating treatment for anybody. I think that it would be extremely beneficial if the court system would embrace the notion of giving the opportunity to people to access care when they realize and they come to the realization that they need it. Yeah. Then again, sometimes mandated treatment is better than no treatment at all, especially for certain individuals that whose behavior is so chronic that continues to repeat a pattern and they come into other people's life and they continue to abuse. So it is
Um,
somewhat of a difficult question. I'm a clinician. I'm not a law enforcement, and I'm not in the judicial system anymore. So I have a lot of mixed feelings around the notion of mandated treatment of any kind.
I have a question that you talked about earlier today when we were videoing, and I forgot where we pulled it from, which I sent it to another person. I don't remember if it was on the CDC or not, but we were talking about oh, Lisa said, yes, I think self-harm or mental health should be a requirement. My fear is they don't realize it continues to happen. Thank you. I'm going to begin to petition for this. That's what she just said, please. There was another question that was coming in from another person, just an earlier video that we had talked about. And we talked about
Lisa, I'm sorry. Let me answer that to Lisa.
Sure.
Lisa, there's actually a lot of literature and there's a lot of jurisdictions that have already engaged in a process of mandated domestic violence treatment. So it varies from state to state. So if you're potentially interested in asking for some form of legislation, you potentially can find a lot of research online about the subject and about the benefits of it. To be quite honest, I have not looked at the statistics, but I know they're out there because they initiated with the mental health courts, and the mental health courts have been in action now in the United States for at least I want to say a better part of 15 years or more. So, sorry.
Oh, no, you're good.
You're good.
You know what I think
You know
is?
what I think is?
Your reverb is
Your
coming from
reverb
your.
is coming from your.
Do you have your
Do you
volume
have
on
your
your
volume
speaker
on your
on?
speaker on?
But I'm in my cell phone right now.
Oh,
Yeah, I'm on my cell phone because I could not figure out in the laptop how to connect to your video.
okay.
My wife told me that I could not connect in my laptop, so I connected to the cell phone.
Okay.
Are you? Yeah. Do you know a way of connecting to the laptop?
I'm
If that's
trying.
the case,
I'm trying, but I couldn't do it. I had no idea how to do it. I'm trying to figure it out. I will figure it out. So there was a question earlier. I was in my earlier video this afternoon. We were talking about ADD and how it relates to domestic abuse and your children. And we were just talking about ADD a minute ago, adult ADD as it pertains to an abuser. But I had read it just a little while ago, and I don't remember if it was the NCSL or it was the CDC. I don't remember. I don't remember if it was NCSL. I don't remember who it was. Now, I know it was child trauma that initiated it. I don't know. But I know that there was ADD that
all of the above, if I may, all of the above can lead to patterns of behaviors that can be abusive. Childhood trauma, there was a study conducted in the 80s that is called the ACE study that has recently in the world of clinicians and even in the judicial system